Thank you very much to the Senior Center for having me. I am very interested in doing whatever I can to help work with people in trying to take care of their health. And this is a really, whole falling issue is a really big one for seniors and for all of us. I'm in this group too. So I'm glad that you're here. I'm glad I'm here. And we're going to talk a little bit about fear of falling or falling out of fear because we needed a catchy title. No, it's also true that there is an issue here about being afraid of falling has some consequences. Anyhow, so we're going to talk about several things. I'm not a physical therapist. I'm not an occupational therapist. So I'm going to leave some of the nuts and bolts of what types of things they do to help people for discussion another time. I want to talk about the whole thing about why we should worry about it and what we should not do and what we should do. First of all, the chance of falling increases with age. Is that a surprise to anyone? No? Good. All right. So the next thing is, why is it dangerous to fall? I have had many patients I've seen over the years who had fallen a number of times and had not gotten hurt. And they said, see, I'm safe. I don't have to worry about this. I haven't gotten hurt. I fell 3 times in the last 6 weeks and I haven't gotten hurt. I don't need to worry. Whoa. Yeah, I hear that a lot, okay? What can happen when you fall down? What are the things that I worry about and what that you should worry about? What maybe you shouldn't worry about too? And why can being fearful about the risk of falling make you more likely to fall? And then can anything be done about all of this to prevent falls and injury? And then what should you not do when you're trying to prevent falls? Don't brag to your doctor about how you haven't gotten hurt when you fell. They don't like hearing that. It makes them anxious. They don't sleep at night. That is not what you should do to try to prevent falls. Overconfidence. And then, of course, for all of us in the room, then what can be my next step in fall prevention? Because I want you all to leave here today with the next step. Even if you're really, really spry and you're doing all sorts of exercise and your balance is good and you're strong and you're healthy, I want you to have some sort of step that you leave here with about how you can prevent future falls. Okay, so the chance of falling increases as we age. Here are some people doing some typical things, or mostly typical things. Most of the people are doing good things. Somebody there is doing something I'm not especially happy about. So turns out up to about 35% of older adults and 45%, almost half the people over age 70 have a significant fall each year. Most of them are not like this guy, okay? And so you can fall even without taking excessive risks. And so that's why everybody needs to think about it, even if you're doing well. So there are a whole bunch of risk factors. There is a handout that you will get on your way out. And this is a fall risk questionnaire. It ties in with what they're talking about. People can come back later and have someone physically assess. But this is a self-assessment you can do at home, thinking about it. In privacy, so you have to answer truthfully, and go over your own personal fall risks, and that can help you guide with what you do. But these are some of the risk factors. Okay, lower body weakness and loss of muscle mass. As we get older, the sad news is that even if our weight stays the same, a bigger percent of it is fat and a smaller percent of it is muscle. So we lose strength as we age. Even if we work to keep strong, we lose it, but you lose more if you don't work on it. But people who are very, very weak are at more risk of falling. People who have decreased balance are at increased risk of falling. Well, guess what? We all get decreased balance as we get older, and it doesn't start at age 65. That is why gymnasts are over the hill by about 25 or 30, because their sense of balance and where they are in space is not as good. And they can't do those 2.5 flips and know when to end it as easily. The decrease in balance starts very early, but it becomes meaningful in this age group. People who have numbness in their feet. Now, unfortunately, that's not as many people, but some people do have numbness in their feet. This is a risk factor for falling because you don't get the same sense from what you're stepping on or standing about where you are in space. Arthritis, and especially knee arthritis, is associated more with falling. And I didn't actually read enough to see if that was because we know knee arthritis is also often associated with weaker muscles around the knee. So there's another thing that is a risk factor, can get people thinking about, okay, they may need to do some. Use of medicines that cause lightheadedness or drowsiness. Well, some blood pressure pills can cause lightheadedness, some other medicines can cause lightheadedness. I'll say more later. Use of medications for sleep or mood. It's unfortunate and amazing how many antidepressants, anti-anxiety medicines, and how all of the sleeping medicines are associated with an increased risk of falling. And so this is another risk factor for falling down. Vision problems. How many of you wear progressive lenses or bifocals? Yeah, a lot of people. Well, what happens is the bottom of your glasses, the floor isn't in focus because it's for up close. And so if there are things around on the floor or patterns or a patterned carpet and there's something on it, you're less likely to see it. And if you have really bad vision, you can't use your vision input to help you balance. So have I hit everybody in the room by now as having a risk factor for falling? Yeah, it's sad news. Medical problems that can cause dizziness even without the medicines for it, like some heart rhythm things or orthostatic blood pressure drops. Fear of falling. And I read one statistic that as many as 40% of older adults have a significant fear of falling, and that changes their behavior in ways that can be counterproductive. Vitamin D deficiency is associated with the risk of falling. Osteoporosis, which is loss of calcium in the bones and making the bones weaker and easier to break, is very associated with actually breaking something if you do fall down. And what people break is often the wrist, because you put your hand out, or your hip, because you land on the hip. And I'll say more about that later. Home hazards. Okay, throw rugs get mentioned a lot. Clutter all over the floor, boxes that got left by the spouse somewhere, and then you don't see them when you're wandering around at night. Dogs, small dogs. I've had a number of patients fall and break things due to their small dog underfoot in the kitchen. And I don't quite know what to do about that problem. Big dogs pulling people over at the end of the leash that they're fine and then they're not, you know. That has happened to people too, injured people. Anyway, moving on. Risk taking. Oh yeah, I wrote unstable ladder use, stumbling around in the dark, riding bucking horses. Like I mentioned, I like horses, you know. Getting bucked off is not a good idea. Been there, done that. Depression is also a risk for falling. So, and depression is treatable. So I'll talk more about that later, but I wanted to mention that because that's another thing that's pretty common in our age group. And it can contribute to people not moving around, to not paying attention, things like that, and not doing as much, and then getting a vicious circle. Any questions about these risk factors, or is there anything important that I left off? Yes?
I don't know if this is okay to add, but you mentioned the numbness.
Mm-hmm.
What causes the numbness?
Okay, good question.
A friend of mine, she's 91, and she has numbness in her hands where she can't pick anything up or put her hearing aids in.
Yeah, yeah.
So I'm worried about that now.
Okay. About half the time, what they call peripheral neuropathy, neuropathy of the longest nerves is caused by, we don't know. Okay. But other things like diabetes, amyloidosis, other neurologic conditions can cause it as well. And so diabetes is the most common cause of people having numbness in their feet where they can't feel. arthritis, pinched nerves can do that.
And is that a fairly typical thing that we have to look forward to, or?
Not really. I mean, people do lose, not putting the hearing aids in can also be because we're not quite as nimble with our fingers, both somewhat due to arthritis, but also due to neurologically, we're not quite as good as like apraxia. They have terms for this. But I've noticed that putting a necklace on, that you may notice that tiny little clasps are harder. Yeah. Anyway, so we need clasps this big, But that is something we get good. It's part of the coordination being not quite as good as our sense of our body in space, our sense of exactly where our fingers are. This is one of those negative things. Yes?
The other thing I find is having confidence. Confidence as far as you have this fear that it's part of being fear of falling, having confidence that you can make it through that one step going down. And you can do it, but sometimes you need a little confidence up here that you can make it.
Confidence, in case you didn't hear. And I agree 100% that.
You do it and you don't think you can do it because you think you're going to fall. You have to think that you're not going to fall, and you can make those couple of steps without grabbing that banister and if you have no banister, sometimes you feel like, okay, I got to do this by myself without the banister.
Yeah, you should have the banister. If you think you might be benefited by it, it means you should have it. But lack of confidence can make people freeze, right? It inhibits you. And that is not good. But we'll talk more about that later. Thank you. You're leading me on. Okay. So 1 in 5 falls end up in fractures in this age group. In toddlers, it's much less. But in this age group, 1 in 5 falls is what the statistic is. And almost all hip fractures are due to falls. Head injuries happen. The late Senator Joe Lieberman was still working on trying to make a third-party candidate for the presidential election when he took a fall and got a head injury and passed away. Now, the head injuries, a lot of it's bleeding into the brain. People in the age group are often on blood thinners because we know that heart and stroke things that can cause other deaths can be prevented by being on blood thinners. It has been exhaustively studied. If you are on blood thinners and you have a risk of falling, it is still safer to take the blood thinner than it is to not take the blood thinner because you're afraid you're going to fall and hit your head. That those risks, people with atrial fibrillation or other bad rhythms or heart failure or who've had a clot in their lungs and are at high risk, those things are even more risky than falling. So I don't want people to say, yes, you could get bleeding in your brain and die and I'm not going to take my blood thinner. Your docs will be after me if I say that. But, and I was leaning that way until there started to be enough evidence that you should take your blood thinner if you're supposed to. Anyway, moving on. Confidence, that's another thing. It ruins people's confidence, and then the fear can make counterproductive actions. And it can keep people at home instead of going out and living their good life in retirement. And that's really important too. Okay. Fear of falling, they've studied and said, well, who are the people who are fearful of falling? I said it might be as many as 40% of older folks. And we know that the older folks get, the more likely falling is, and fear of falling, and various types of debility. So factors associated with being older, being female. Well, of course, there are more female people around than male people around as you get much older, so that's a statistical thing. Having less education seems to be associated. People who have more physical problems, and people who have more medical conditions, are just not feeling in as good health and as vigorous, and they tend to be more fearful of falling. And depression, anxiety, I said cognition, that's, people talk about memory loss with talking about dementias, and it's not always memory, it's judgment, it's planning, all these things can be a little bit, people who have trouble planning their strategies about, okay, I need to get from here to there, there's no banister, and you know, it's a slippery wet floor because I mopped it and now I'm over here and I need to be there. You know, people who aren't as good at planning how they're going to get around those types of things, like you can wait. No, people forget that they could wait. You know, so that's another risk factor. Less safe environment. If your spouse is a hoarder, you know, you have you're at more risk. If you have the little dogs, if you're in a ramshackle house and you need to have people come in and repair things that aren't working, this can make you more fearful that you're going to fall. If you don't have banisters. Okay, so this is how this works. So the first thing is, I think what was alluded to about people freezing, that people can hold themselves stiffly. And that really is a good solution if you only have to stand there. And you're a little unsteady and stuff. If you tighten up your muscles, yeah, that helps. But we don't just get up out of a chair and stand there, do we? We go somewhere, we do things. We're going to go reach for something, we're going to go move. And the being stiff and out of the fear of falling is counterproductive. It interferes with the complex coordination that our body intrinsically kind of knows to do. But when we superimpose the stiffness, you can't move as fluidly and do the things to have the parts of your body work together as well. So that's one of the things, that the stiffening out of fear. If you're anxious due to fear, then a lot of times that anxiety bubbles up, not just from the, oh my gosh, I could fall, to it makes you more, it ties into other anxieties, and there you are, you're on alert. And then suddenly the fire department siren goes off, and you're walking and you get a startle from that, and then you're not paying attention to your walking, and down you go. So the anxiety about falling can contribute to falls. And it also, aside from distracting you and maybe you're not paying attention, you miss the handrail when you grab for it, it also decreases working memory if your attention is all focused on being anxiety. And working memory is part of what helps us get around. And then if you're constantly afraid of falling, the brain just goes into autopilot about, okay, we're going to be cautious, and then it increases your falls. Does all that make sense? I'm seeing some nodding. Yeah, some people might have experienced some of this. And then if you're afraid of falling, you move less, right? Which is a natural response. I've had a gazillion patients over the years that they're afraid they're going to fall, so they spend a lot of their day in the recliner chair, and they only get up if they have to do 2 or more things. So, and other than that, in the old days, they would have hopped up, oh, I need a drink of water. They go get water, they come back. Oh, I have to go to the bathroom. They go to the bathroom. Oh, that's right, I wanted my magazine. They go to get their magazine. Well, nowadays, with the fear of falling, what do? They sit in the recliner until they say, I guess I have to go. Then they go to the bathroom, they get their water, and they get their magazine. So they're only using the muscles to get up out of that chair a third as much because of grouping that, which, you know, heck, we're in the use it or lose it phase, right? And so they're going to lose the function because this grouping, to decrease the number of times they have to walk across the floor without falling, then increases the chance of the next fall. So I see that so much. And then with fear of falling, then people tend to shift their weight incorrectly, and the physical therapists amongst us know more about the details of that, and that they have decreased balance as well as the strength. And then if people are not moving less, or not moving as much, then they're also tend to not want to get out of the house a lot. One thing I hear a lot from a lot of people who have fear of falling, and maybe someone told them they should use a cane or a walker, is that they don't want to go places and use it because they don't want people to think they're an old person. My dad was notorious for this. It took, he had to be very debilitated. In his 90s, he finally got debilitated enough and fell enough, including in front of me, that he finally started at using those sorts of things eventually. But so people move around less. They get out less, they have less social interactions, they don't come to the wonderful things at the senior center, and then if they're depressed, they'll be more depressed. They're not moving. The act of getting from your car in the busy parking lot and negotiating all the traffic and then up the hill to the door here, that's exercise. And if someone's staying home and not doing it, that's exercise they didn't get. Getting in and out of the car, that can be, especially if you have a low car like I do. Anyway, so, any questions so far? Okay, good. All right. So then we're going to get to I'm mostly vegetarian. I would say the meat of the issue otherwise. And what can be done to prevent falls? Okay. First of all, everyone should work on increasing their home safety, and we'll go into some details, and exercises to maintain or increase their balance and strength. So like, it means like if you catch COVID and you spend 5 or 7 days hanging around in bed and having your muscles get weaker, even if you're normally not having any problems, you should think, I'm going to work on strengthening myself back up, because you get deconditioning even after a couple days of lying around. So everybody needs to have plans about what they could be doing. Maybe they get out of a chair twice every time they're getting out of a chair to go get their drink of water or their magazine. They get up, sit down again, get up again. You've doubled the number of times that you've worked these muscles. Walking is pretty easy, doesn't use your muscles as much as getting up and down out of things. You may have noticed it's harder to get, how many of you are jumping out of bed nowadays? It's harder to be doing other things to get upright than it is to just walk along. But anyway, that's, what else should I say? Oh yeah, and then people who have more fear of falling, people who need assistive devices, people who've had falls, they should get additional help through the classes we have here that Julie mentioned, and there's going to be a Matter of Balance, a program this fall that's really excellent and has been proven to help. And there's the SAIL classes, and they're on Zoom, and they're in person here. Or a referral to a physical therapist from your physician or nurse practitioner or a physician's assistant, your primary care person, can send you to physical therapy if you have a fear of falling. Or if you feel unsteady or you're worried that you might be at risk for falls, they can send you and give you a program that's tailored for you. Avoid or minimize substances that increase fall risk. Alcohol is really common one, and the caricature of the person who's had too much to drink and is staggering around. It takes less to be too much. As we get older, we don't break down the alcohol as fast, and a little goes a long way. And for a lot of reasons, cancer prevention and everything, they're starting to think that maybe for women it's 1 or less per day, and men 2 or less per day. And I think that, even that might be a little generous depending on your baseline balance. Drugs, including over-the-counter, cannabis may make people less fearful of falling, but I'm not sure that's a good thing sometimes. That's all I'll say about that. Over-the-counter medicines can also increase the risk of fall. All the sleeping medicines over the counter, allergy medicines, those are known drugs that increase the risk of falling. And medicines, long lists of medicines. Many people in this room are probably on 5 to 7 medicines, or more, perhaps. The more medicines you're on, the more likely they are to have drug interactions, and they think that anybody on 5 or more meds is at risk of what they call polypharmacy, the dreaded medical term. And you should take as few medicines at as lowest dose as possible that you can. People end up getting, these meds do high blood pressure, mood, and others, I mentioned that. But people get side effects from medicines, and then they get prescribed another medicine for the side effects. So somebody is taking medicines and they get constipation and they think it's their irritable bowel. And so then the doctor gives them a medicine for their irritable bowel, which then gives them another side effect that they then take another medicine for. And so it's the thing that geriatricians will often say is that they don't usually oh yeah, geriatricians, let me do a side thing. Do I have time? Yes. Geriatricians, okay, that's a doc who's had additional training and taking care of older folks. Mostly we don't see people in our own private practice taking all comers. Most of them work just seeing referrals for people that are just not doing well and have a lot of complex medical conditions. And the question is the interplay between them and what can be done. And the experience of geriatricians is that they help more people by taking medicines away than they do by diagnosing new problems and adding medicines or adding some treatment or adding some test. And I've had that experience myself, you know, of taking medicines away, say, gee, you're on these couple fairly benign medicines, but you're not doing well and you're not thinking well. Well, let's try tapering off of them. Boom, person's better. Person's having trouble sleeping. Well, maybe that their sleeping medicines aren't getting out of their system, or they're tired in the daytime as evidence of having trouble sleeping. Well, maybe their sleeping medicines are still in their body, since a lot of them have a half-life that can be 8 hours or more. And they're drowsy in the daytime because of the pill they took to help them go to sleep the night before. And they might be better off if they weren't taking a sleeping pill and they were exercising more and doing some of the other things that people do. But that's a whole nother talk. So one of the big things is medicines that are anticholinergic. Docs throw this term around. And so Julie asked me to define it better. So it's basically the brain has acetylcholine receptors, and that medicines that block that increase your risk of falling and make you drowsy and give you dry mouth and can constipate you. And so like sleeping medicines plus an antihistamine for allergies plus some of the bladder medicines are also anticholinergic. And people could be really increasing their fall risk a lot because these drugs all interact. Cholinergic, the medicines for, the most common medicine, Aricept for Alzheimer's disease to help people get worse slower. What they do is they increase brain acetylcholine. So when you take medicines that are anticholinergic, you are like taking an anti-Aricept type of a medicine. And a lot of medicines are anticholinergic, and there's big long lists, and I'm not going to put that up, and I'm not going to test you on it. All right. Oh yeah, home and yard safety measures. Okay. Always dance with other people. No, that's not true. I think if you're safe at it, dancing alone is fine and it's good exercise. Okay, these are things everybody can do in their house. Install handrails by your commode, in your shower, so that if you have a momentary slippage or loss of balance, you have something to grab. A wet countertop is not going to help you if you're falling. It's fine to hold on to if all is well, but when you're falling, you need something you can grab onto. Handrails by steps, the banister. Yes, the old-fashioned classic term. That you want to have that. So if you have 2 or 3 steps going up into your house and you don't have a handrail by that, it's probably time to get that. That's preventative. It's good safety. And if you do fall down and break something, then you will be really glad that you got it before you got injured, because it's good, you know, it's good to have it already and not have to run around. If necessary, use a shower seat sitting down for showering people who get lightheaded, either from medicines or medical problems. If you can sit down in the shower, you know, and can use a handheld extension to the shower, and you should have grabbers there. Bright lights in the house. Okay, LEDs are cheap. They can make a lot of bright light. Our eyes, as we get older, don't let in as much light. Our pupils are smaller than little kids. They have big pupils. We got little pupils. Not as much light comes in. So if you are in the dark, you're not going to see well. So you want to have bright enough lights that you can see. And a night light in the bathroom is a great idea. I mean, unless you have a street lamp that's shining in. People fall in their bathroom at night. It's dark at night. People get up to go to the bathroom at night. I'm not going to ask for a show of hands, but I know that some of you do. And it's dark, and people are half asleep, and they're turning around, and they're getting up off the commode, and all these things. And when you pee or poop, there can be reflexes that decrease your blood pressure and further increase the risk of falling. Have a light so you can at least see what you're doing, and a grab rail. Chair in the bedroom for seated dressing. You don't have to do, what I do in the mornings is stand there and put your pants on or your sweats on. Standing up. If you're having trouble with your balance or your strength, that is not a safe move. And you can have a chair. Who knew? Avoid clutter on the floors. We talked. Keep items off the stairs. Remove throw rugs. We mostly tend to have throw rugs, and we think they're safe because they have little rubber things under them, but statistically they are not. And then this was a new one for me when I was researching the talk. The physical therapists know all this, but keep frequently used items at a good level. If you are doing like what I do to get a big pot out of the underneath, way back in there part of my cupboard, if my balance wasn't pretty okay, that would not be good to be doing that. You don't have to keep things you use frequently way down there or way up here where you got to get on a step stool. You can keep them at the right height. Just look at your kitchens, look at your bathrooms, and you can put the frequently used things where it's convenient. Wear proper footwear. People wearing slippy, slidey, old slippers or moccasins. I see them all the time, that not only do they not support people's feet, but your foot can kind of come out of it and be half on it, and it's not giving you a good sense of where the foot, and you can trip because of falling out of your shoe. And that's a very embarrassing thing to tell the health people. So wear proper footwear. Oh yeah, so any questions at this point? Yes?
Okay. Could you tell us, please, when you're falling, when I have fallen, and I've had some very bad falls, the first thing I think is not, put your hands out, no. Something happens, my brain is not there. There is no brain function from the time I start falling until I'm there, and then I hear my teeth on the sidewalk, or, seriously. So what would you, and then two, in a way, I'm glad I didn't put my hands, I would have broken my wrist. So what do you suggest while you're falling?
Well, while you're falling, I like that you're not putting your hands out, because that is how people break their wrists, is that your wrist is not strong enough to consistently break your fall at this point. And ideally, people, if they feel that they're falling, they should try to roll, but your problem is that you're not thinking in the moment.
Maybe I could train my brain.
Training, exactly, you got it. What has to happen is that you have to be trained in a strategy for how you deal with that. Well, the first thing is trying to decrease the chance of falling. So the first part of the strategy is, okay, what were the circumstances of your fall, and what could be changed in terms of how you got in that circumstance, and then what could be changed about your strength to maybe, because oftentimes decreased strength is a part of it. And so working on all of that, getting a plan for that, and then working on a plan of how to learn to try to fall in a way that is a safer way. And that all requires a specialist, not me. That's where the physical therapy type people are your invaluable resource for being able to go on a one-to-one, and say, this is the problem. I've had these falls. My brain freezes. I don't know what to do if I fall. Can you help me problem solve how to keep falls from happening? And then if I do fall, can you train me to learn a movement so that you're not just struck with terror and just there and not able to do anything. Anything that we want to do, we can learn a movement to do that. Whether it's in music, you know, I love music. If I want to do something or avoid something, what I have to do is drill it. And with your body, it's the same thing. If someone's going to train for the Olympics, they're going to drill their body in a certain movement till they don't have to really think about it, that's just their default. So I would say training and asking specifically for that type of an approach with referral. Yes?
I just wanted to add, I mean, we do that in our sail classes. We actually emulate that, you know, stepping and losing our balance, and we training our muscles and our minds to respond to keep us from falling. And yeah, some it's boring and we repeat it, but firsthand, I can say that I've caught myself because my body has been practicing it. So there is definitely ways to work on that.
My strategy so far has been not to leave the house.
Yeah,
Oh.
that's what we're not.
We want you to have a better strategy.
Here was
We want a better, and okay, and you can get that strategy even here with the sail classes.
Yeah.
So that's
You're
good.
right next to a sail instructor, so, you know.
Okay, so thank you for asking that question, because I think that a lot of people are in that situation of, oh no, there you're going, and what do you do? And it's too late. By the time you can think, what do I do? It's too late. It has to be, what you do has to be in the sort of body control part of your brain, not the thinking part of your brain. And it's training. So, great question. Let's see. And here we go. Activities to promote balance and strength, decrease fall risk. That's SAIL program, and this is what it stands for. Stay active and independent for life. And they have them here. They have it on Zoom. They have it in person. And you can talk to anybody who's knowledgeable here about how to sign up, or you can go on the website and hear more about that. But, oh yeah, before that, if someone says you should use a cane or a walker, please do. That is so common that people do not. And if you do it, don't just use a cane that somebody left out on the street with the free stuff. Get instructed in how to use it properly. If you have one leg that's weaker than the other, both sides are not an equal way to use it. There's a right way and a wrong way. And the height of the cane and all of that. And walkers should be thought of as a powerful tool. They are not a sign of weakness, they are a sign of power. I was involved in my group. At one point, I had a member of the group who needed to use a walker because of her medical conditions. And she reframed it as this is her superpower. Because if she was out to lunch with friends, she and her walker, and they needed to cross the street and there was no light and there's busy traffic. With her walker, she led the way, taking a few steps, and everybody could see it. And the traffic would stop and all her friends could come. So I think that if you do find that an assistive device is in your life, view it as a tool, a powerful tool, because it gets you where you want to go. And that's the bottom line, is we don't want to have our various medical problems interfering with having a life. We want to be able to keep having our best possible life. We've gotten to retirement age. Most of us are retired. And we should be able to use that time in the ways we want to. We should be free. And devices can make you free. If you cannot bring yourself to use a cane, a number of people can get out and about using hiking poles. There was one of the guys in the first picture. Those help too. Again, they should be used correctly. I went walking with a friend of mine who will remain nameless and who does not live in this community, who finally is using her poles. And she's not using them right. She's a physician and she's not using them right. Okay? Although she needs to for her medical issues. Use them right. Get taught how to use them right. Do what the people tell you. Yes?
There is a class in pole walking offered through the Santa Rosa Senior Center. It's usually offered once a year, I think, in late fall.
It's just like cross-country skiing. If any of you cross-country skied or even downhill skied when you were younger, or maybe you still do. I do know some people well into retirement who still ski. It's a crossing thing, you know? So it's, let's see, let me get this right. That way. Okay? That's the brief lesson. But,
This is my dance partner.
all right, another term. Yay. Yeah.
I get to lead.
Okay, yeah, you get the lead, all the better. Anyway, so we're good, we have time, yeah, I can. So walking, I could talk for the whole hour on walking because you name the problem, walking is good for it, okay? Anything. Name a problem. Anybody want to name a problem? Stump the doc, yes.
I have, my leg doesn't work. It's, I get pain behind my knee and it goes down into my calf and it seizes up on me,
Uh-huh.
which started from sciatic.
Yeah. So sciatica, well, interestingly enough, most of the time when people have sciatica and their nerve has been irritated in their back, one of the key things people should do is, even though it is painful, they should walk. It helps them hold their body in the right position. It strengthens the muscles instead of letting them get weaker from not moving. And so for people with sciatica, spinal stenosis, all that sort of stuff, they should walk. So, okay, didn't stump me. Anybody else want to stump me? Yes.
Sometimes you have a tendency, you're walking, and what do you do? Put your hands in your pockets. You shouldn't keep your hands in your pockets and walk around the block or something, because that's really not good, because you need your hands out of your pockets in case you are gonna trip and fall. You wanna at least have your hands, you know, available. You don't wanna fall with your arms out and try.
When you're walking, okay, good point. When you go walking, putting your hands in your pockets, you lose all that good motion. Just like with the poles, you know, that the poles, part of what the poles do is they help you do that motion with your arms that helps you balance and propel yourself forward. If your hands are in the pockets, you don't have that. So you didn't stump me. Anyway, other medical problems. If you have high blood pressure, you should walk. You have diabetes, you should walk. You have weak muscles, you should walk. You have depression, you should walk. You have anxiety, you should walk. You have insomnia, you should be walking and exercising, because that's part of what makes you tired enough to fall asleep. So anyway, so this is just one of my little sneak this in, you know, for my interests in trying to help people stay healthy, the walking. Okay, and then, you know, learn a home exercise program. We've got the SAIL class, physical or the fall prevention programs. And then I wanted to mention a couple other things. So A Matter of Balance is coming in the fall. Do you have printed info about that on the, not yet? Okay, but it is coming. It's a grant. It's a proven to work program for people who have an increased risk of falling to decrease the risk of falling. It will increase confidence, increase strength, teach people what they, you know, how to carry forth. And like I say, it's about living your best life. Okay, SAIL, we got that going on here, ongoing. And you can talk to anybody here, talk to the SAIL instructors who are here, or you know, go online, sign up. Tai Chi, there's some Tai Chi classes that have been studied, like this is one, Moving for Better Balance. I couldn't find that it was present in this community, but I did want to mention that things like Qigong and Tai Chi are also things that can help improve your ability to move and decrease your fall risk center. And there's often other sorts of Tai Chi. Anyway, but so that's another thing. There's an online thing through the Sonoma County Aging website.
AAA. Area agency.
Area Agency on Aging, Fall Prevention and Better Balance. This is an online thing. So if you can't get out, this is another thing. I think you should do the other things too, and you should come here to the SAIL classes or do the online SAIL classes here. But here's one more thing you can do, so you can keep busy and out of trouble. Physical therapy referral, your primary care person will be happy to make a physical therapy referral. The physical therapist, if you haven't been, how many of you have been to a physical therapist here? Okay, okay, so most of the, preaching to the choir for the most part. You go and they assess you.
Physical therapists will come to your house. There's a group, I can't think of the name of the group, but that's what I had after I fell because I wasn't leaving the house.
Yeah.
And she came and helped me a lot. She would walk with me to get me. I was too scared
Yeah.
to walk outside.
Yeah.
So,
If you have something happen to you where you are homebound, or you're generally homebound and you don't go anywhere, but you did come here today, thank you for being motivated enough to do that. But if someone is homebound by Medicare's definition, which means they don't go out to eat with their friends, but they can go get their hair cut, and they can go to doctor's appointments. But if you're technically homebound, then your primary care provider can make a home health referral that can include physical therapy and can include occupational therapy. If you think you have hazards all over your home or things you want advice on what to do, they can assess your safety at home. And they can send nurses out if that's appropriate too. A lot of people get home health nursing. But yes, people can come to your home if you are legally homebound, and Medicare will pay for it. And they will assess you, whether it's in the home or the office. They will do a very thorough assessment, much more thorough than I ever do in the office. And they will make a plan for you. They will start helping you exercise. They will teach you how to do it, walking with you, as you mentioned. And then for the home one, and oftentimes in the office, as long as you keep improving, you can keep going by Medicare rules. When you plateau, then they're going to end up having to discontinue you from that service. So if you go to physical therapy, if you get a referral, work like heck, because the longer you keep getting better, the longer you can get their get So I wanted to emphasize that's a great deal. Yes?
How do you get up? Well, what's the best way to get yourself up?
Okay,
You're not
I have a video, but the sound isn't working on it with this system. But you can watch this person, watch what she does, and I'll show it to you at the end. Thank you. I didn't plan. What? 7 minutes?
You got 7 minutes.
Okay, well then I'm almost at the end. And, okay, yes.
One more thing that I can't emphasize enough is a good yoga program.
Okay, yoga.
Balance, strength, flexibility, oxygenation, and helps in the brain. And of course, help with anxiety. But I wouldn't go to just a one-size-fits-all yoga class. You need to have somebody to help you adapt the movements to your capabilities.
Okay, so somebody, a sort of a more individualized yoga.
Yeah, or a smaller studio.
There's chair yoga here.
It's chair yoga.
One-stop shopping. Okay, so what we're going to do is there are brochures outside. One of them is there are several fall risk assessment scales, and I got one of the shorter ones. But what you can do is you can use your polls. See, there they are. You can do a self-assessment with the fall risk questionnaire, and that will help you identify sort of, rather than globally, oh no, I'm at risk of falling. It can help you pinpoint just sort of what types of things are the problem areas. And you can look at your home, what can be done to make it safer. Ask your family or friends if they have if they've noticed anything. Because a lot of times people have lived in the same place for a long time, and you don't even notice the hazards anymore. You've just gotten used to stepping over that thing. So ask people. There are local agencies that can also help, like with home repairs and stuff. I didn't want to go into it. And just do it. And then make your plan to maintain or improve strength, balance, and confidence, and follow through. Make yourself accountable. Tell somebody about your plan. If you tell somebody, it makes you more accountable, because they might ask, so, are you still doing that? And you'd rather tell them yes than no, right? So sign up for sale, a matter of balance. Use good judgment, the ladders, just all the things that I see people do. And if you're depressed, get treatment and get out more. Getting out more is strong depression treatment too. So, and it's another thing. Getting out more is probably good treatment for almost anything that ails you. And then the last thing I wanted to show you was some resources. What I wanted to do is I'm going to go to the website. This is your senior center's fall prevention website page, okay, because it has all sorts of things. So, and if I scroll it down, talks about the fall prevention series, here we are, and then it has this nice video someone wanted to see about how you get up from the floor, and I think I'm gonna finish with that because it's about 3 minutes and some. It has balance, it says what you can do, pretty much what I said, except I was more long-winded. It has the videos from their previous lecture series. That's just great. And that's great. Well, and he's going to talk to you about it. Music in the brain, all sorts of things. Vision, yoga, all sorts of things. So these are good things. And some more resources, fall facts, other resources, publications. But I'm going to leave you with, or actually, I tell you what, are there questions? Because then I can put the video on. It has no sound. We aren't hooked in for sound. So the video can play and people can ask me questions because there's no sound anyway. So let me take questions first and then I'll play that in the background. Yes?
If you're talking about strengthening your legs, if you're getting up and using something to help you get up, are you using enough muscle to improve?
If you're needing to use something else to help you get up, there's room for improvement, and you might need to use that some of the time, but then at the same time, also having a program of doing things to strengthen those muscles. But if you're having to get up out of the chair and you need to use something because you got to go to the bathroom, well, you don't have time to get your muscles all strengthened in time to do that. So you can be doing things both. You can be doing the short term, this is getting by, this is how I'm going to get by with this problem. Plus, you can be seeing the physical therapist or doing your program you were already prescribed to work on getting stronger and learning other ways rather than pulling yourself up instead of using your leg and abdominal muscles. Good question. They've all been good questions.
Would using poles to walk with help with that kind of issue?
Using poles to help with, it helps with balance issues because you get additional information as the pole touches the ground, and it helps you remember to swing your arms, which people, if they're stiff, they're not, I'm afraid they might not be swinging their arms in a way that helps them. It does not strengthen you really. The act of walking more will strengthen you more than not having done so. And if you use your poles correctly, at first your arms might get sore because you're going to get better arm muscles as well. But it doesn't, in and of itself is not enough to make somebody's fall risk factors of decreased balance and decreased strength get better, enough. But it's a way to decrease your chance of falling right then and to get out and be moving, which is so important. Other questions? Okay, we're finished. I'm gonna put this on and you can watch it if you want. You can come up and talk if you want. You can leave, take a fall assessment brochure, and thank you all very much for listening. I don't think anybody fell asleep. Thank you for that. Thanks.